Thanks very much for having this panel. I think having a discussion of public health mixed in with the discussions around technology is important. When I think about the challenges we face in public health and as we face in a world, there are these big threats of things that can destroy populations, epidemics, massive natural disasters like we're seeing. But then I think about what we face every day, and it's the everyday problems that I think are critically important for us to face as a society. At the Robert Wood Johnson Foundation, we're focused very much on what it takes for everybody in this country to have a fair and just opportunity for health and well-being. And as you look at what the drivers are of health and well-being, it's not about whether you have a doctor to go to. That accounts for about 20% of it. It's critically important, and we may touch on the legislation that's being considered in Washington, and I think the dire impact that would have on people's access to care. But that's about 20%. What it really comes down to are those factors where we live, where we work, where our kids learn, and where they play. Are we creating communities in a society that makes it easy to be healthy, that makes it easy to get access to nutritious food and for us to have physical activity, where it's easy for people to have jobs that pay a living wage so that they're not working 3 or 4 jobs that don't have benefits and give them access to health care? Are we creating those factors in our society that lead to health? And I think we're going to come around to it as a nation, as a world, that these are things that everyone should have access to, and we're going to take that on. We gave out our Culture of Health prizes yesterday, and I was in little county in central Kansas, Allen County, where this county of 13,000 has decided that they're going to do what it takes to make their county healthier. They were aware that people were leaving their county. There wasn't a good reason for people to stay. There wasn't a supermarket. There wasn't a place to be active. And they've taken that on and have decided we're going to make it better. And those little bright spots around the country give me hope that as a nation, we can do what it takes to give everyone that sense of the system works for them.
And we're basically on the same page, so that's kind of why I had him start. But my whole thing is about prevention, and I think that the biggest problems that we have are those lifestyle conditions, the chronic illnesses like diabetes and hypertension and strokes and behavioral health, and the things that we talk about. They're not sexy, but they're what's there. And that's really what we need to address, and if we're going to change health in this country. One of the things I'm doing in our clinic, I'm back in my little clinic in Biola Battery, Alabama, but we started a health policy research center. And the reason I started this health policy research center, it's called the Gulf States Health Policy Research Center, is that it focuses on the 5 states that border the Gulf of Mexico. And while we have great hospitals, we have great doctors, we do have access to care, but something's keeping our health outcomes poor. We have the poorest rankings in the entire country. So it must be something. I suspect that it's health policies. So we're starting to do science and evidence-based research using an NIH grant to start this center to study those things like, if you think of my favorite topic, tobacco. In Louisiana, the tobacco tax is about 50 cents a package on cigarettes. In New York, it's $5.50. Those policies matter, and you will see young people are much more sensitive to price. Are there other policies around? We have policies around how many liquor stores or in a community really have outcomes. And so looking at those policies, and so we've given out grants, and we'll have a theme issue of a journal coming out. But those are the type things we need to do. But we're also focusing on the community, having the community participate and say, what is it that we need? And we've got young people and people who've worked in the community all these years, all of a sudden looking at research and saying, I'm a researcher. As Dr. Francis was saying, people who were afraid of research, afraid of participating, is now interested in showing some evidence of what they need. And so that's the sort of thing I think we need to focus on in the future.